Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, review courses, review books, review videos, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Which I know I always like to get into my disclaimer and reminder before getting started with our questions that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I am talking about things that we do currently in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states the nurse practitioner is considering treatment options for an acute gout flare. All of the following are acute treatment options except: is it A, NSAIDs, B, allopurinol, C, colchicine, or D, glucocorticoids? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first to ensure that you're answering what is being asked of you. Here, the stem of the question states all of the following are acute treatment options except. So, we're looking for the incorrect answer. So, what are we talking about? The nurse practitioner is considering treatment options for an acute gout flare. So, what are our acute gout treatment options? Are NSAIDs an option? Yes, NSAIDs are acute treatment options for gout. Is B allopurinol one? No, that's not an acute treatment, although it is utilized as treatment. It's prophylactic treatment for gout. So B is your best answer, but let's look at the rest of them. Colchicine, yes, that's an acute treatment. And then lastly, the glucocorticoids are also utilized as acute treatment. So you can use NSAIDs, allopurinol, and your glucocorticoids, okay? Question number two, the nurse practitioner is prescribing prophylactic treatment for a patient with a history of gout. What are the best prophylactic treatment options? Is it A, NSAIDs and colchicine, B, colchicine and allopurinol, C, Uloric and allopurinol, or D, Uloric and colchicine? Take a moment and tell me what you got in the comments, you guys. So the stem of the question here states, what are the best prophylactic treatment options? So all right, now we're looking for prophylactic therapy, but let's see for what. So this patient has a history of gout. The nurse practitioner is looking for the best prophylactic options to treat. Okay, so is it A, NSAIDs and colchicine? No, as just discussed in the last question, NSAIDs and colchicines are acute treatment options. B, colchicine and allopurinol. Allopurinol is a prophylactic option, but colchicine is acute, so we can eliminate this one. C, Uloric and allopurinol. Yes, C is your best answer. Uloric and allopurinol are utilized to reduce the uric acid levels and is utilized as prophylactic treatment options for gout therapy, okay? And then lastly, question number three, what lab value should be monitored when considering gout as a diagnosis? Is it A, an A1C, B, a uric acid level, C, a TSH, or D, a hemoglobin? Take a moment and tell me what you got. And here, the stem of the question is the question, what lab value should be monitored when considering gout as a diagnosis? And the best answer is B, a uric acid level. As I was talking about with prophylactic therapy, because your uric acid levels can be elevated with gout, most commonly what the source is, you want to monitor those levels, and you also want to monitor it once you start to implement those prophylactic therapy to make sure it's being maintained within a normal range, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. And if you need any of the resources that I offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number one at gmail.com. The things that I offer are my review book. You can get it in an ebook or paperback option. Both are linked in the bio of this channel. My self-paced review for family and adult Gero testing for AANP as well as ANCC is also linked in the bio of this channel. Our 5-week intensive group review, the next one is in September. The link is in the description if you're looking to join that. And then lastly, my one-on-one sessions. I always say reach out to us if you're looking to book any of those sessions because they are customized. You can get a session for weaknesses, you can book an exam readiness assessment, or you can book our custom package where you are provided with the pretest, and based off of the time frame that you're looking to study, I structure a study plan for that time frame and work alongside with you to take you to a successful exam attempt. Okay. So if you're looking to utilize any of those resources, click the link in the bio for the ones that you may be interested in, or give us a call or shoot us an email. But make sure you meet me back here. Happy studying. Bye, y'all.